Morning everyone to the second annual Public Oral Health Conference, and it's great to see that again we've got a significant attendance, and it's good to see everybody out on a beautiful Saturday morning in sunny Melbourne. I'd like to firstly acknowledge that our platinum sponsor for the events today, and that's Southern Dental Industries. I'd also acknowledge a range of VIPs that are here today. Firstly, our keynote speaker, Dr. Brendan Murphy from Austin Health, CEO at Austin Health, and I'll introduce him in a more fulsome manner a little later on. I'd like to also acknowledge that some of my fellow board members who are here today, Kathy Bell, Pam Dalgleish and Jenny Thesinger. I'd also like to acknowledge that one of our speakers later on is Natalie Savin, and not only is she one of our speakers of today, but she was also served on the board for a period of 9 years and was in fact my predecessor as chair of the board for 3 years from 2006. So welcome Natalie if you're already here. Thomas Cheetham from Southern Dental Industries, Alvin Lee from Quit Victoria, Eleanor Schroeder and Mark Doherty from RMIT, Manuka Abuza from the University of Melbourne. I'd also particularly like to acknowledge the first Australians on whose land we meet today, the Wurundjeri people of the Kulin Nation, and pay my respects to their elders both past and present, and the elders of other Victorian Aboriginal communities, whose cultures we celebrate as amongst the oldest living cultures in the world today. So, today is about sharing ideas and innovations that will determine the future of public oral health in Victoria. And let me just point out, yesterday we had for the management cohort of our services an innovations forum. And can I encourage you to have a look for this little booklet, which is a synopsis of some of the posters that are around the place and some of the presentations that were provided yesterday. They're in piles out the back. I think it's a good read, and it really shows that as an industry, we really often look outside the square and do things to benefit our cohort of eligible patients, often in spite of the system. So today we're talking about and looking at focusing on the delivering high quality and cost effective services that make a real difference to the health of our community. We've fought for a number of years to make oral health part of general health, and I think to a very large degree we've succeeded in that, and we've got to keep the impetus in that direction. But it is challenging times for public dentistry. We've made huge gains over the last 12 months because of the National Partnership Agreement and the new money from the Commonwealth. But guess what? The next round of the NPA has been deferred. I don't know if that's code for we'll ever see it up again in the last budget. And to put that in context for Victoria, that's $50 million that we won't have in our system that we expected to have in the next financial year. So we need to do more, and we need to continue the momentum with actually less resources. So the challenge is it's always there, it's always ahead of us. So how do we do that? Today we'll be looking at new models of care that increase accessibility for patients and looks at providing a bigger range of services within the same cost base. So we've got a great lineup of speakers to educate us today. Our keynote speaker, Dr. Murphy, will look at how we create a more sustainable health service in the context of redesigning the workforce. Associate Professor Helen Dewey will be showcasing a multidisciplinary approach to clinical care. Kathleen Phillip will share new directions and developments from the allied health sector, and Jane Martin from the Obesity Coalition will talk about her work in health promotion. We're also lucky to have a range of experts from the public dental sector amongst the lineup, and they'll be sharing the great work they've been doing. For example, Dr. Martin Hall and his team from North Richmond Community Health Centre will share the great work that they're doing to increase the scope of practice of dental assistants. And Martin was very eloquent last night at the cocktail function, and he got more eloquent as the cocktail function went about the wonderful presentation he's got for us today. There's still a challenge though. In public dentistry, we have 30% of Victoria's population that are eligible for our services. Of that 30%, we only treat 20%. So we treat 20% of the 30%. Now, when I was up here last year, I said we treat 15%, I think 14 or 15%. I'm just looking at Deb for verification of that. So we've come a long way in a short period of time, and that's a 5%, but we still have a gap that we've got to close. So we need to think about that in our context of discussions today. The definition of insanity has said that we can't keep, or one of them, that we can't keep doing what we've always done and expect different results. Now, I think that's a good context for us to think about and look at what we do and how we do it. So thanks to all our esteemed presenters. I'm confident you will leave today full of great ideas and new innovations, and perhaps more importantly, names and numbers that you can share and say, I'm going to ring you, I'm going to come and see what you do that can make our work differently. So it gives me great pleasure now to invite Dr. Brendan Murphy to deliver his address on health workforce redesign for a sustainable health system. For the last 9 years, Dr. Murphy's been running one of the major acute facilities in Victoria, and that's Austin Health, where he's the Chief Executive Officer. Prior to his appointment at the Austin Health, he was Professor and Director of Nephrology and Chief Medical Officer at St Vincent's in Melbourne. He's a board member of the Florey Institute of Neuroscience and Mental Health and President of the Victorian Hospitals Industrial Association. He's also been a researcher, or maybe still is a researcher, and has been the recipient of significant NH and MRC grants. Deb's worked with him quite closely in workforce reform and tells me that he's passionate and committed to making a difference. He strongly believes that we can't afford to keep doing things the way we've always done them, and we need to evolve. He served on the board of the Health Workforce Australia board for 5 years and currently chairs the Victorian Health Workforce Reform Task Force. So please join with me in welcoming Dr. Murphy to the stand.